You know, pregnancy is one of the most profound journeys a person can take. It's this time of huge transformation, both physically and emotionally. So the kind of care and attention you get during that time, well, it really matters. Today, we're going to dive into a model of care that completely rethinks that entire experience.
Okay, so to understand where we're going, let's start with what most of us are familiar with. Just picture that typical prenatal checkup. It usually follows a very specific and, let's be honest, very efficient script.
So, you get there, and first things first, the cuff goes on the arm. Check. Then out comes the tape measure to check on the baby's growth. Check. And then you get that magical whoosh whoosh sound of the baby's heartbeat. Check. All the clinical boxes are ticked. But what does all of that really add up to?
Well, the whole visit is often over and done in just 10 to 15 minutes. It's a model that's really built for efficiency, designed to screen for problems as quickly as possible. And look, that screening is absolutely vital. But it does leave us with a pretty critical question.
Is a sort of transactional, checklist-based approach really enough for one of the biggest transformations of your life? For a lot of people, the answer is a hard no. And that's exactly where a different philosophy of care comes into the picture. So, let's talk about the holistic midwifery model. And it's not just about having longer appointments. It's a fundamental shift in perspective. And it all starts with one simple but incredibly powerful action.
This quote from midwife Grace Fox really gets to the core of it. The foundation isn't about just checking boxes. It's about listening. But as we're about to see, there are very different ways to listen. Now, this is where it gets really interesting.
The conventional model is fantastic at listening for symptoms, right? It filters everything through a diagnostic checklist. But the midwifery model, it's focused on listening to a person, to understand their worries, their hopes, the entire emotional landscape of their pregnancy. And to do that, you need the one resource that's often in very short supply: time.
And this chart just says it all, doesn't it? Instead of that quick 15 minutes, midwifery appointments are usually somewhere between 30 and 60 minutes long. That extra time isn't just for small talk. It's for building a relationship, it's for education, and it's for supporting a really core philosophical idea.
And this right here might be the single biggest shift of all.
Our modern culture often tends to frame pregnancy almost like a medical condition, something that's inherently risky and needs to be managed. Midwifery offers a totally different point of view.
I mean, just let that sink in for a second. It's such a powerful reframe. For the vast majority of people, pregnancy is a natural, physiological process that the body is literally designed for. And when you start treating it like an illness, well, that can have some real consequences. Because when the main mindset is just about managing risk, every tiny deviation from the norm can feel like a potential emergency. And that can trigger what's known as the cascade of interventions. It's kind of like a domino effect. It often looks something like this. One intervention, let's say continuous monitoring, makes another one, like an epidural, more likely. That in turn can slow down labor, which then increases the chances you might need a vacuum or even a C-section. The key thing here is that this cascade can sometimes create the very outcomes it was trying to prevent, outcomes that might have been avoided with a more patient approach. So what's the antidote to this fear-based model?
The antidote is confidence. More specifically, it's the kind of confidence that comes from deep knowledge and preparation, which is an absolute cornerstone of midwifery care.
The goal isn't to promise some perfect pain-free birth. That's not realistic. The goal is to make sure parents feel prepared and capable, no matter how their birth story actually unfolds. And this is achieved through something called informed confidence.
This is so important. Informed confidence is not about having some rigid 5-page birth plan that can be broken. It's about knowing your options, understanding the pros and cons of each, and feeling truly empowered to make the best choices for you in that moment. And that education, it's not some separate class you have to sign up for. It's woven into every single visit.
In those longer appointments, you're talking about everything, from nutrition and the stages of labor to newborn care and postpartum mental health. You become an active, educated participant in your own healthcare journey. But you might be wondering, does this feel-good model actually lead to good outcomes? Well, the data says a resounding yes.
So let's look at the research, because this isn't just about a different vibe or a nice idea. Multiple large-scale studies show that for low-risk pregnancies, this model is linked to some really tangible positive results.
And the research is pretty compelling. Landmark studies, like a major Cochrane review, found that people getting midwife-led care are less likely to have a preterm birth, they have lower rates of C-sections and instrumental deliveries,
they're more likely to have a spontaneous vaginal birth, and, no surprise here, they report way higher satisfaction with their care.
Okay, so with all this information, the natural next question is pretty obvious. Who is this for? Is midwifery the right fit for every single pregnancy?
Well, the evidence strongly supports midwifery for low-risk pregnancies, but for high-risk conditions, things like preeclampsia or placenta previa, the specialized tools and surgical access of physician-led care are absolutely essential. It's not about one being better than the other. It's about matching the right level of care to the specific need. It's about the right tool for the job.
And as you're exploring your options, you might come across the term CPM. It just stands for Certified Professional Midwife. It's a credential that signals some really rigorous training, with a special focus on care in out-of-hospital settings, like homes or birth centers. It's just one more piece of the puzzle to understand when you're finding the right provider for you.
Because ultimately, this all comes back to a really personal question. Whether it's with a midwife or a doctor, in a hospital or at home, what does an empowered, supported, and confident path to parenthood actually look like for you? Thinking about that, well, that's the real first step on any path you choose.
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.